Hello and welcome. Today, we're diving into a serious condition affecting the urinary system, ureteral trauma. This is an injury to one or both of the ureters, the tubes that carry urine from your kidneys to your bladder. It's a medical issue that requires prompt diagnosis and treatment to prevent potentially severe complications. So, what causes ureteral trauma? The most common cause is iatrogenic injury, meaning it's caused by medical procedures. This can happen during abdominal or pelvic surgeries like hysterectomies, colon resections, or even kidney stone removal procedures. External trauma, such as car accidents, falls, or penetrating injuries like gunshot or knife wounds, can also cause ureteral damage. Rarely, ureteral trauma can be caused by spontaneous rupture due to a pre-existing condition. Let's break down the pathophysiology. When the ureter is injured, urine can leak out into the surrounding tissues. This urine leakage causes inflammation and irritation. Over time, this can lead to the formation of a urinoma, which is a collection of urine outside the urinary tract. Scar tissue can also develop, leading to ureteral stricture, a narrowing of the ureter. Both urinoma formation and ureteral stricture can obstruct the flow of urine, backing it up into the kidney, a condition called hydronephrosis. This back pressure can ultimately damage the kidney, potentially leading to kidney failure if left untreated. Ureteral trauma is relatively rare. Iatrogenic injuries account for the majority of cases. The incidence of ureteral injury during open abdominal surgery is estimated to be between 0.5 and 3%. Laparoscopic surgeries carry a similar risk. External trauma resulting in ureteral injury is even less common, occurring in less than 1% of all trauma cases. However, it's important to note that these statistics can vary depending on the specific type of surgery and the patient population. The signs and symptoms of ureteral trauma can vary depending on the severity and location of the injury. Some patients may experience flank pain, which is pain in the side of their body, or abdominal pain. Blood in the urine, known as hematuria, is another common symptom. Other symptoms might include nausea, vomiting, fever, and a general feeling of being unwell. In some cases, especially with minor injuries, there may be no noticeable symptoms at all initially, making diagnosis more challenging. Diagnosing ureteral trauma often involves a combination of imaging and clinical evaluation. A CT urogram, which is a CT scan with intravenous contrast, is the gold standard for detecting ureteral injuries. This allows doctors to visualize the ureters and identify any leaks, obstructions, or other abnormalities. Retrograde pyelography, where dye is injected directly into the ureter through the bladder, can also be used. In some cases, ultrasound may be helpful as an initial screening tool. Blood tests to assess kidney function, such as creatinine and BN levels, are also important in evaluating the overall impact of the injury. Ureteral trauma can be classified based on the mechanism of injury and the severity of the damage. Injuries can be categorized as contusions, lacerations, complete transections, or avulsions, which is a tearing away of the ureter from the kidney or bladder. Furthermore, the injury can be graded based on its depth and the amount of urine leakage, typically using a standardized grading system. This classification helps guide treatment decisions and predict the prognosis. Treatment for ureteral trauma depends on the severity and location of the injury, as well as the patient's overall health. Minor injuries such as small contusions may only require observation and placement of a ureteral stent to allow the ureter to heal. More severe injuries, such as lacerations or complete transections, usually require surgical repair. This can involve re-implantation of the ureter into the bladder, called ureteroneocystostomy, or connecting the two ends of the ureter back together, called ureterostomy. In some cases, a nephrostomy tube, which drains urine directly from the kidney, may be placed to temporarily divert urine flow and allow the ureter to heal. Laparoscopic and robotic techniques are increasingly being used for ureteral repair, offering minimally invasive options. While it's impossible to completely prevent ureteral trauma, especially in emergency situations, there are steps that can be taken to reduce the risk. Surgeons can take precautions during abdominal and pelvic surgeries to carefully identify and protect the ureters. This includes meticulous surgical technique, clear visualization of anatomical landmarks, and the use of intraoperative imaging when necessary. For external trauma, wearing seat belts and following safety precautions can help minimize the risk of severe injuries. The prognosis for ureteral trauma is generally good with prompt diagnosis and appropriate treatment. Most patients can achieve full recovery of kidney function. However, delayed diagnosis or inadequate treatment can lead to complications such as ureteral stricture, hydronephrosis, kidney infection, and even kidney failure. Recent advances in minimally invasive surgical techniques, such as laparoscopic and robotic ureteral reconstruction, have improved outcomes and reduced recovery times. Research continues to focus on developing new methods for preventing and treating ureteral trauma, including the use of bioengineered ureteral grafts for complex reconstructions.